Not too long ago, we would have seen a case in the newspaper with respect to a parent talking about a situation that would have gone before the courts, where she would have been seeking health care be provided to her with respect to a boy, her son, who would have been born with microencephaly. We saw that headline in the newspaper talking about children deserve care. And it is something that, because we would have spoken earlier this week with Dr. Sabga, and it would have been with regards to pediatric cancer. So we are fully aware at this point that there are particular health challenges that our younger population, our infants face in this country. It's something that we take for granted if we are very honest with ourselves. We see health challenges as really being something that people acquire at middle age and their later years in life. But we know in this country that, and in the Caribbean as a whole, non-communicable diseases, it's an issue that face many of us. And that's why we would have seen the government take a particular position when it comes to, for instance, soft drinks in the school cafeterias and so forth. So we cannot get away from the fact that our population from newborns go straight up are faced with health challenges. Now, we have with us Dr. Nisha Maharaj, and she is a consultant pediatrician. And so she's going to help me to understand a bit more about microencephaly and how it is affecting our infant population and others as well. Dr. Maharaj, good morning and welcome to AM Prime.
Good morning, Nikoli. Good morning, Trinidad and Tobago. Thank you for having me today.
My pleasure.
So I will give you a brief description of microcephaly. So it is a birth defect where the infant's brain is smaller than what is expected of a child of that age and sex. So, and what is micro? Micro is small. Cephaly is brain. So a small brain means that there's enormous ramifications for children who have such issues, and it affects the entire life of the child from birth onwards. So it is a lifelong problem that doesn't get better. And so the problems that they face range from overall health issues, developmental issues, and a total of life expectancy issues, and it affects their life in every facet that you can think about.
And I know that where we may see it in other parts of the world, especially in more developed countries, family planning is taken very seriously. So you would see couples who have made that conscious decision to have children and so forth. They may be going to their physician, ensuring that they are healthy. There are particular tests to see compatibility and so forth. But in Trinidad and Tobago, if I am to think or to go based on just experiences and having conversations with people, a lot of the times there are unplanned pregnancies, even within married couples and so forth. So we don't have that undertaking where people are making that decision to go to their to their physician and to ensure compatibility and so forth. So how serious is this issue? And when I say serious, I mean in terms of rates of this happening, this taking place, microcephaly, in our infants. Is it something that we're seeing more often than not, and especially in recent times?
So that's the issue with Trinidad. We don't really have all the information that we really could. So like, I know that part of this discussion was going to be about Zika. And we in Trinidad in 2016, we had 294 cases. But in Brazil, there was 29,000 cases. And so a lot of research was done. So I don't actually have figures for you about how many of our children actually fall within that spectrum.
Sure. And so is this something that is preventable? And even for persons who their child is born and it's recognized that this birth defect is what it is, what kind of care is available to such couples or parents?
So I'm glad that you actually, I'm glad actually to be here, because this is an issue that is very close to my heart. And to be honest, there isn't much for children really offered out there to help families as well as the children. So abroad, because I spent a lot of time in the United Kingdom. So as soon as, these issues are spotted, there's something called early intervention therapy. And they start that from as soon as birth. So they start to work with the children from birth to 3 years, with their extensive programs that help them in all aspects of their development. And sadly, that isn't available to parents here in Trinidad. And so when I actually saw the article where the mom won her case to get care, I myself was deeply saddened to see that they were challenging that decision, because there really is very little available to the average parent with a child with a birth defect.
And that's kind of confusing because, and this might be a rhetorical question, but of course, if you can answer it, we see in this country where we have, at the University of the West Indies, we have the School of Allied Nurses, or the Allied School of Nursing, and so forth. So it means that people are coming to Trinidad and Tobago to learn medicine. We're churning out doctors every year in mass. And of course, there is that glut of junior doctors, because you have to move on to specialize and so forth. That takes some more time. It requires more resources. Not everyone is up to that challenge, if we are honest with ourselves. But we have seen over the years a very strong investment in terms of the health sector, at least in terms of manpower. Why is that not then translating into the kind of care being made available at different levels?
So I've been told, because I spent a lot of time in England. So 15 years I was abroad and I came back. And when I realized there were no resources really for children with special needs. And when I asked, I was told that at a governmental level, there isn't an interest in providing the level of care that you require for these children. So medical care is only part of it. So as a doctor, we can provide, medical care for you, but that is only a minuscule factor in their care. They need interventional therapy. So interventional therapy is speech therapy, occupational therapy, physiotherapy. Some of these children, they have problems. They don't even know how to roll over. So basic things that you take for granted, like when you're born, you develop, you learn to roll over, you sit up, eventually you stand, eventually you walk. Some of these children never develop. So they are literally, I'm not familiar with this mom's circumstances, but this 6-year-old may actually still be lying flat in a bed and unable to roll over. So interventional therapy is what we need. And so we need to focus on hiring a department or setting up a building, as they do abroad, where children can come and get integration of care. So you'd have the physiotherapist, the speech therapist, the occupational therapist, the physiotherapist, so they can get what they need. Because if you're unable to move, then you need a wheelchair. So the occupational therapist would assess your weight, your height, and design a wheelchair that's appropriate for you. So the medical care is only one part, but they need so much more.
And even with that, because we've been talking about that care being offered in the public health space, but is there any interest, as you are aware, any interest in private sector in terms of providing such medical care or therapy to treat with cases such as this?
Right. So there are some therapists that are available, but they are privately run. And for most parents, the prices of those sessions are unattainable. Because you don't need one session, you need a series of sessions. And you might need a series of sessions over years rather than weeks. And the average parent can't access it, can't afford it.
Yeah, and I just see so many opportunities for medical tourism if we were to actually make these kinds of investments in these areas, because we can't just think about our population alone. I would imagine that across the Caribbean, they may have faced similar challenges, and that would have been a perfect opportunity for Trinidad and Tobago to make these investments into the health and well-being of not just this country, but the region. But unfortunately, I feel as though many a times we can't see beyond our noses. But I digress. I know that we're going to be talking about Zika as well. How serious, well, not serious, but Is this something, the Zika virus, is this something that is top of mind for the population? Or is it that, just during a particular rainy season or whatnot, when we see more mosquitoes, that's when we start to think about it?
So Zika, as you know, is a virus, and the carrier is the Aedes aegypti mosquito. And so the only way to control that is to have more aggressive spraying, because that's the way you kill them, which I don't think we've had been sprayed for quite some time. So it's just one of the viruses that the Aedes aegypti mosquito can disseminate. Yes. But Zika, I think, showed its ugly head in 2016. I can't see any research showing that we've had any recent cases, and that would fit in with the mom with a 6-year-old. 6 years later. Yeah. I don't think we've had a recent case. I think it comes to light because, as I said, most of the research is in Brazil, but they've had close to 30,000 cases. And it's a big deal because 1/3 of the children of moms who are infected with Zika will have something called Zika congenital syndrome. And that syndrome really ranges symptoms of neurological features. So you're looking at anything from seizures, a small brain, also known as microcephaly, developmental problems, visual problems, hearing problems, swallowing problems. So it affects, it goes for the brain.
Understood. Well, help me to understand in terms of, let's say someone is infected with the Zika virus, a pregnant mother. In terms of being able to identify that she has been in fact infected to the point of, let's say, treatment of any sort, what does that process or those steps look like?
So the unfortunate thing about Zika is that most people who get infected won't have any symptoms. And if you do have symptoms, it's going to be non-specific. So the usual, when you have a virus, you can have fever, a bit of rash, a bit of conjunctivitis, which is inflammation of your eyes, and maybe just feeling unwell, something we call malaise. So these symptoms are really non-specific. So most moms probably won't know they've had it. And you will probably discover the small brain when we do the ultrasound scan at a certain point in the pregnancy, where we look for what we call fetal anomalies, and then it's discovered, by which time it's too late really to do anything.
So it more or less boils down to a case of this is going to be the situation moving forward, where they will have a child who has a birth defect, and it is about caring for that child moving forward without the real possibility of that child living a normal life.
Correct. There is nothing normal about when you have a small brain. Everything is affected. Everything. So, you would expect these children, if they're unable to do basic things like feeding themselves, taking a bath, getting dressed, things that we take for granted, they won't be able to do. So if you can imagine, as a baby, we do everything for the baby. But then at the age of 6, you expect them to be dressing themselves, brushing their teeth, eating for themselves. And unfortunately, a child with microcephaly will not be able to do these things.
Yeah. So what is the message then, Dr. Maharaj, moving forward to the population, to our listeners, as it relates to this? What should we be taking away to, let's say, reduce our chances of seeing more cases like this?
I think we need a more aggressive program where we spray our parts of Trinidad so the Aedes aegypti mosquito is eliminated. I think that's the only thing we can do, because unfortunately it's endemic. Aedes aegypti mosquitoes, that they live and breed here. So in terms of prevention, it's more aggressive spraying programs. But for me, the problem is, once we have children who are microcephalic, not only from Zika. Zika is not the only thing. There are other infections. There are other reasons why you might have a small brain. But if I would like you, I would like to impact Trinidad and Tobago to understand that you're right. It's not about a red shirt or a yellow shirt. It's about us, the people of Trinidad and Tobago, and we need to do more for our children because they are the future. And when you have a small brain, that future becomes very, very minute in terms of what you can achieve. And so we need to have early intervention therapy we need to invest in that. We need to get the therapists that we require. Because as you rightly stated, there is no deficiency of doctors. There are enough doctors to provide medical care for these children, but we need the interventional therapy.
Yes, and finally, where can we get more information on the effects of the Zika virus, but also microcephaly?
So there's a wealth of information on the internet about microcephaly, which is easy for the average person to read and understand. And in terms of Zika virus, Ministry of Health, if you go onto their website, there's a small area where you can access information. And then, of course, if you, the internet, again, if you type in Zika virus, a wealth of information comes out as well. But what I really want to impact on our listeners is if we as a nation try to clamor for better management, we need to clamor and we need to rise and demand from the government that our children need early intervention therapy when there are birth defects or when there are any issues that affect their development. We need to have an industrialized program where parents can access a national program where parents can just go and access the care that the children need. Because it's one thing to provide care for the children, but the families also need support. So if you think about this mom with a 6-year-old, she has to do everything for this child. I'm sure she has to lift him. She has to change nappies. She has to shower him. She has to feed him. She has to do everything. And that's a 24/7 job. So what they do abroad as well is the parents get something called respite care, where nurses come in and look after the child for a few hours so the parents get a break.
Yeah.
So we need more investment in children with special needs.
And one can only hope that we actually get to the point where citizens do come together and advocate for that exactly that you're speaking of. Dr. Maharaj, thank you so much for taking the time to come and have this discussion. It was very enlightening for me, and I would imagine for our listener, for our viewers, and hopefully something can come out of this, because we should never have another scenario such as that mother and that 6-year-old. So thank you again for coming onto the program.
Thanks for having me.